Getting a diagnosis of ovarian cancer can feel, well, really overwhelming. But if you can understand the path ahead, it can give you a real sense of clarity and control. So in this explainer, we're going to walk through that journey, step by step. We'll look at the options, the goals, and what you can expect. Let's get started.
So let's jump right into the big question. How is ovarian cancer actually treated? Well, the thing is, it's not just one single answer. It's usually a combination of therapies that are put together just for you. For most people, it kicks off with surgery, and that's often followed by other treatments that are designed to attack the cancer from a bunch of different angles.
Before we get into how it's all done, let's talk about why. Every single treatment plan, no matter what it looks like, is built around these three main goals. First, you want to physically remove as much of the tumor as you possibly can. Second, you got to eliminate any cancer cells that might be left hanging around in the body. And third, and this is a big one, you want to do everything you can to prevent the cancer from coming back. Everything we're about to talk about serves one of these key goals.
You know, it's so important to remember that no two cancer journeys are exactly the same. And that's why the very first step is always creating a personalized map. This is not a one-size-fits-all kind of deal. It's a strategy designed specifically for you.
So what exactly goes into building this personalized plan? Well, your healthcare team looks at a whole host of factors. And as you can see, it's not just about the cold, hard medical facts, like what type of cancer it is or what stage it's at. It's also a deeply personal process. Your overall health matters, your personal wishes are front and center, and even your plans for the future, like having children, are part of the conversation. It's truly a team decision.
And this right here, this quote highlights something that is absolutely critical: having the right expert leading your team. The research is crystal clear on this one. When you're treated by a gynecologic oncologist, that's a specialist in these types of cancers, the outcomes are just plain better. Finding a specialist is one of the most important things you can do right from the very start.
All right, so for most people, the treatment journey kicks off with surgery. It is one of the most powerful tools they have, especially if the cancer is caught in the early stages. So let's dig into how it's done. Okay, so there are two main ways a surgeon might go about this. The one you see more often these days is laparoscopy. It's minimally invasive, which means it only uses a few small incisions. The other option is a laparotomy, which is a more traditional open surgery that involves one larger incision. Now, the goal is the same for both, but a laparoscopy typically means you're back on your feet a lot faster.
So what's actually happening during the operation? Well, the surgeon has two main goals: get the cancer out and figure out if it is spread. This can involve a few different procedures, like removing the ovaries or the uterus. But a really key objective is something called tumor debulking, which is just a technical way of saying the surgeon removes as much of the visible cancer as they possibly can. They'll also take small tissue samples, or biopsies, to see if anything is spread to nearby areas.
And here's some really good news. For some people, especially those with very early stage cancer, this one step, the surgery, might be the only treatment they need. If the surgeon can get all of the cancer out, that could be it, which is an amazing outcome.
But for a lot of people, surgery is just part one of the plan. The next phase is very often chemotherapy, and it's used in almost all cases of ovarian cancer, except for some of those very, very early stage 1 cancers.
I know the word chemotherapy can sound pretty intense, but the process itself is actually very structured. It's given in what they call cycles. So a cycle is basically getting the chemo drugs and then a really important rest period. This break, which usually lasts a few weeks, gives your body some much-needed time to recover. Then you repeat the process, typically for about 3 to 6 cycles in total.
So how do these drugs actually get to where they need to go? There are two main methods. The most common is intravenous, or IV, where the medicine goes right into a vein, kind of like a highway system for your body. The other way is intraperitoneal, or IP. With this one, the drugs are delivered right into the abdominal area through a small tube, putting the medicine as close to the action as possible. Okay, let's be real for a second. Chemotherapy does come with side effects, and yeah, they can be tough. Things like feeling exhausted, nausea, and hair loss are pretty common. But the absolutely crucial thing to remember here is that these effects are almost always temporary. They tend to go away once treatment is over, and your doctors have a lot of tools to help you manage them along the way. Now, beyond traditional chemo, we're seeing these smarter, more precise ways to fight cancer. They're called targeted therapies. And unlike chemo, which can affect all sorts of fast-growing cells, these drugs are designed to zero in on the specific things that make cancer cells, well, cancer cells. This often means fewer side effects, which is a huge plus. This first one is a really clever strategy. Basically, you starve the tumor.
You see, for a tumor to grow, it needs to build new blood vessels to get nutrients. Angiogenesis inhibitors step in and block that process. No blood supply means no growth. It's a pretty brilliant way to slow the cancer down.
Okay, if the last one was about starving the tumor, think of this one as a heat-seeking missile. It turns out a lot of ovarian cancer cells have a specific protein on their surface. These drugs are engineered to hunt for that exact protein. And once they lock on, bam! They deliver a dose of chemotherapy right to the cancer cell, while leaving the healthy cells around it alone.
And then we have PARP inhibitors. What's so cool about these is they're often just a pill you can take at home. And they work by taking advantage of a weakness. See, some cancer cells, especially those with a BRCA gene mutation, are already pretty bad at repairing their own DNA. PARP inhibitors come in and block their last repair pathway, which causes the cancer cells to just die off. It's a really smart approach.
So we've covered surgery, chemo, and targeted therapies. Those are the big three, but that's not the entire toolkit. For very specific situations, doctors have other effective options they can turn to.
For instance, some types of ovarian tumors are actually fueled by hormones like estrogen. So it makes sense, right? You can use hormone therapy to lower those hormone levels or block them completely, cutting off the tumor's fuel supply. And then there's radiation. While it's not used as the main treatment very often for ovarian cancer, it can be really effective for treating specific spots where the cancer might have spread. And we absolutely have to talk about clinical trials. This is where the future of cancer treatment is happening right now. Taking part in a clinical trial can give you access to the next big thing in therapy long before it's available to everyone else. Plus, you're helping researchers make breakthroughs that will help so many people down the road.
All right, so we've walked through the treatments, but what happens after they're all done?
This last part is all about the road ahead. It's about survival, it's about hope, and it's about the incredible importance of having support.
And I want to start with a number that is just so full of hope.
When ovarian cancer is found at stage 1, the 5-year survival rate is an incredible 93%. That number is a powerful testament to how effective modern treatments are, and it really drives home just how vital early diagnosis is.
Now, to give you the complete picture, the overall 5-year survival rate, when you look at all types and all stages combined, is 50%. And while that number shows us the challenges we still face, especially with later stage diagnoses, it's also a number that keeps getting better and better year after year, thanks to all the progress we've been talking about. And that brings us to our final and maybe most important point. This journey through cancer treatment isn't just physical, it's a huge emotional marathon too. So please remember that asking for help from your family, your friends, a support group, that's not weakness, it's strength. Reaching out for support is one of the absolute best and most powerful things you can do for yourself.